Honorable Minister of Health for the Republic of Uganda, Dr. Jane Aseng, and honorable ministers here present, frontline health workers, presidents, CEOs, organizational leaders and representatives, esteemed speakers, members of the Shapers Council for today's event, honors guests, all protocols observed. Welcome, Wamgelekile Karibu, to the almost 300 people registered across 4 continents for this important conversation. As you're all well aware, today's event is entitled, Sorry, I seem to have lost you there. My name is Shone and I'm the Country Director for Mothers to Mothers South Africa, Chief of Party for M2M's USA-funded Rise 2 mechanism also, and the MC for today's event. It gives me great pleasure to formally open today's proceedings. We have a remarkable lineup of speakers, and it's our fervent hope that today we will all be exposed to new thinking, inspired to strike new partnerships, and to see things in a different light as we seek to achieve a healthier, more equitable future I know we all desire. On the screen now, you'll see a brief summary of the program for today, which is also available in an online version, which is being placed into the chat now. I'll also be shortly handing over to Frank Beadle de Paloma, President and Chief Executive Officer of Mothers to Mothers, for his opening. Before I do that, I'd like to cover a few housekeeping points. We have prepared an online program as shared for today's event with the details on the speakers and the sessions. Please access using this link shared in the chat. There's also a toolkit for social media, which is also being shared in the chat with you all now. We are using the Zoom webinar platform, as you all know. This means that only our speakers will be appearing on our screen. As participants, you will not appear on the screen unless you raise your hand to ask a question. We strongly encourage you to do this. We want to hear those voices. However, please do be aware we are recording this session, so your questions and comments may be recorded if you choose to engage this way. On the subject of questions, you can choose to ask a question using the Q&A function in the chat or by raising your hand to speak. There'll be a time for questions and discussions in almost all sessions. There's also a dedicated LinkedIn group for this event, which we invite you all to join.
Hello, everybody. I'm afraid we seem to have some connectivity issues with our MC, Shumbi. So my name is Dylan Mann. I am going to take over and introduce our first speaker for the day. So let me just start my video so that all of you can see me. So bringing my greetings from Cape Town, and it is my pleasure to step in and introduce Frank Beadle de Paloma, the President and Chief Executive Officer of Mothers to Mothers, to provide today's opening remarks. Frank has more than 30 years experience in the global health community, and that includes significant achievements in the HIV prevention, domestic and global care, research, policy, and advocacy. Frank leads a team of more than 2,000 people at Mothers to Mothers across 3 continents. Before joining M2M as CEO in 2012, Frank was the Senior Vice President and Director of Global Health, Population and Nutrition Group at FHI 360. Prior to that, he was the Senior Vice President and Director of the Academy for Educational Development, AED, where he re-established the organization as a leader in global AIDS programs. He also created and directed the National Council of La Raza Center for Health Promotion in the United States. Frank, over to you for your opening remarks.
Thank you so much, Dylan, and I hope that we can get Shombi back a little bit later. Honorable ministers, esteemed fellow speakers and guests, ladies and gentlemen, all protocols observed. I am delighted to welcome you all to this event. I want to start by acknowledging my fellow speakers in this opening session, who are my colleague, Wilbroda Awor Akuro, one of M2M's frontline health workers and a team leader in Matari North, Kenya. Also, Dr. Renata Talarico, our youth team leader of the United Nations Population Fund for East and Southern Africa. Schedule permitting, we also expect to be joined a little later by our guest of honor, the Honorable Dr. Jane Ruth Aseng Osero, the Minister of Health of the Republic of Uganda. I would like to also pay special tribute to our Shapers Council, who have been instrumental in helping us to think through the program for today's event and who have provided invaluable assistance in connecting us with speakers, generously sharing their insights and many other contributions. In no particular order, the Shaper Council has consisted of Justine Mirembe from the United States Agency for International Development, Carl Bjorkman from the Bill and Melinda Gates Foundation, Dr. George Awor Matete from BRAC, Dr. Joanne Peters from Johnson & Johnson, Dr. Katrin Schmitz from Mothers to Mothers, and Jyoti Shankar Tiwari from United Nations Population Fund. I am sure many of you are familiar with Mothers to Mothers, but please allow me to briefly introduce the organization as I set the scene for today. Mothers to Mothers, also known as M2M, is an African not-for-profit organization that was founded in 2001 in Cape Town, South Africa, where we still have our global headquarters today. Our model is a peer-based model. We train, employ, and support African women living with HIV to provide health services, support, and education to other women, their children, and families. From an initial focus on preventing mother-to-child transmission of HIV, we have carefully evolved our work into related areas, including broader sexual and reproductive health, non-communicable diseases, and early childhood development. Our vision is to create health, hope, and an HIV-free future. Thanks to the remarkable skills, dedication, and passion of our frontline teams and the staff that support them, this model has reliably delivered transformational health outcomes at scale, as well as providing employment and empowerment opportunities in some of the most marginalized communities across the African continent. October 2021 marked 20 years since Mothers to Mothers was founded. Over the past 2 decades, we have proven beyond a doubt that when empowered African women work as frontline health workers, they unlock life-changing results for their communities and for themselves. From a single site in Cape Town in 2001, we now work across 10 African nations, reaching well over 1 million clients a year. Some of our proudest achievements in the past 20 years include reaching more than 13.5 million people in sub-Saharan Africa with life-changing health services, helping to keep approximately 1.2 million women alive who may otherwise have been at increased risk of maternal mortality, achieving the virtual elimination of mother-to-child transmission of HIV for our enrolled clients for the past 7 years in a row, helping a new generation start life HIV-free, helping 4.4 million at-risk adults stay HIV negative since 2013, and creating over 11,000 jobs for African women living with HIV as frontline health workers. With that background in mind, I'd like to share with you why M2M chose to convene today's events. Colleagues, while I'm proud of everything we've achieved as a global health community in the past decades, and the role M2M has played, we have to be very honest. I need to be very frank. We are not on track to deliver universal health coverage by 2030, and we have to act fast to course correct if we are to achieve this goal together. COVID-19 brought an uncomfortable fact into sharp relief. Healthcare service delivery models are fragile, especially community health worker models, and many do not work when in-person services are impossible. But COVID-19 also has the potential to act as an accelerant for massive positive change. For today, the concept of universal health coverage lives in the public consciousness like no other time in recent memory. If we can capitalize on this awareness and momentum, we have the ability to deliver meaningful change. COVID-19 also shined a light on digital tools to deliver health services. As you will hear later in more detail from my colleagues Marjorie and Boule, M2M has many years now used digital tools to deliver and measure our in-person services. Marjorie and my colleague Will Broda, one of our frontline team members in Nairobi, will share how in 2020, we were able to rapidly pivot to provide a hybrid of in-person and digital services to meet the ongoing and new health needs of the communities we serve and protect, as well as our frontline staff. This included the development of a WhatsApp chatbot available in 27 languages across 9 countries. With the increased attention on digital tools to deliver services during COVID-19 and their role in delivering universal health coverage, we have been concerned about 2 trends. The first is that all too often, digital health or digital self-care is seen as a standalone concept. It is our belief that a closer attention needs to be paid to how digital and in-person services are best integrated for maximum impact. Second, we are also concerned that frontline health worker voices are missing from the conversation in many spaces. We hear a lot from the designers of digital tools, but less so from the users of such tools, but often nothing from the health workers who promote, share, and integrate these tools into their work. Our hope is that today's event will provide a unique platform for program implementers, policymakers, national governments, and various stakeholders to share their experiences and openly discuss these issues. We know we will not uncover all the answers immediately. Still, by sharing emerging learnings and identifying key unanswered challenges, we can all contribute to charting a path towards achieving the Sustainable Development Goal of good health for all by 2030. We hope that this gathering will begin to catalyze new thinking and new partnerships, helping to create a healthier, more equitable world. With the goal of ensuring health worker voices are raised throughout today's event, I am now extremely pleased to introduce my colleague, Wilbroda Awar Akuro. Wilbroda joined M2M in 2016 as a frontline health worker and quickly rose to the ranks to become a team leader. She now leads our team of community mentor mothers in Matari North, just outside of Nairobi, meaning her work is a balance of frontline duties and team leadership. As a result, she has been instrumental in the rollout, use, and refinement of M2M's digital health tools in her community. Wilbroda has also served as an official M2M spokeswoman since 2019, a role which has seen her bring her important perspective to many high-profile spaces. She is a tireless advocate for women and people living with HIV, and she is a true inspiration for all of us. Wilbroda, over to you.
Well, thank you so much, Frank, for the introduction. Your Excellencies, esteemed ministers, fellow frontline health workers, honored guests, ladies and gentlemen, all protocols observed. I am delighted to join you to share how Mothers to Mothers is integrating the digital and the personal to help improve the health and well-being of women, children, and families across sub-Saharan Africa. My name is Wilbroda Awar Akuro. I am a community mentor mother team leader in Nairobi, Kenya, where I lead a team of 13 mentor mothers. Our model works because of the empathetic care, education, and support that we provide our peers at the health facility or in their homes. As community health workers, we take off pressure on stretched nurses and doctors and health systems. Crucially, we create deep bonds with our clients because of our shared experiences. I know this because I was a Mothers to Mothers client myself in 2015. I was diagnosed with HIV when I was just 5 months pregnant. My mentor mother would call me in her personal capacity to find out how I was doing. It's in our nature as mentor mothers to always want to be there for our clients. Since I joined Mothers to Mothers in 2016, digital tools have become more integral to our work. We use 2 apps to plan, manage, and report on our in-person meetings, and importantly, to follow up with clients who fall out of care. It has streamlined our workload and makes it easier for us to respond to the real-time needs of our clients, with their health data at our fingertips, of course. We also reach more clients as we no longer have to go through big paper-based folders, and it's made us more focused on results. We all have targets of the number of clients we need to reach through eServices. When COVID-19 hit and the lockdown was introduced, I saw fear and confusion in Kenya like never before. The Mothers to Mothers team had been declared essential workers, but most of our clients either could not or would not go to the clinic to access health services that they desperately needed. I was glad that we already had solid digital foundations. It made the services much easier. It made the urgent need to change to full remote delivery of our services much easier. This benefited our clients and protected our team as well. As restrictions eased up, the in-person and remote services have become one. Through calls and services, I ensured my clients were still receiving services and health education. I reminded them of their appointments and how to attend to them safely. I connected them with other community health workers who helped them get their treatment. The virtual Mentor Mother platform, our WhatsApp chatbot, which we launched in August 2020, meant I had the most up-to-date information to share with my clients regarding COVID-19, HIV and AIDS, or even parenting and nutritional care. It really made a huge difference. In the first lockdown, a client was stuck in the countryside without her treatment. And her baby was also due for important vaccination. With transport at a standstill, it would be hard for her to travel for her treatment. And so we worked together with the clinicians to ensure that the client received her treatment as well as the baby's vaccinations. Through calls and texts, I ensured my clients were still receiving services and health education. I reminded them of their appointments and how to safely attend to them. I connected them with other community health workers who could help them get their treatment. This shows that with the help that we give the client, it shows the power of eServices. eServices are key to complementing what we do as mentor mothers. It strengthens active client follow-up. It helps us cater to our clients' needs. It simplifies our work, but it won't ever replace the additional services, education, and the compassionate care we share in person. Without those, we could miss other health-related issues that clients might share, cases such as intimate partner violence. Moreover, not everyone has a phone. Sometimes only the husband does, and we have to wait until they get home for us to connect with our client. As community health workers, we know the challenges and opportunities our communities face and the tools needed to support them. Our on-the-ground knowledge makes us key thinking partners in the future of digital health. That is why, on behalf of my fellow Mothers to Mothers Mentor Mothers, I would encourage everyone today to involve us more in the process with our buy-in and our access. We can make these tools more effective and used more widely by all. I am looking forward to today's conversation and working together to help us deliver health, hope, and an HIV-free future. Thank you.
Thank you so much, Wilbroda, for the powerful testimony and speaking on the use of digital health technology in your work as a peer mentor mother. It's amazing work, and we are able to do what we do because of the work that you do. So thank you, Wilbroda.